Hello. For this coursework, I decided to undertake a case study for Nigeria. So in the next couple of slides, I'll give an overview of the current situation of the health financing in the country, highlighting the challenges and also try to attempt to provide some recommendation for improvement. This is the snapshot of the country from the health economics and access perspectives. As we can see, Nigeria is peculiar in that it's a highly densely populated, developing and emerging country. For that reason, it is overburdened with myriads of diseases, both communicable and non-communicable. Unfortunately, the majority of the 180 or so million people in the country do not have access to good quality, equitable healthcare, and we will see the reasons later. Despite the various sources of finances for health in Nigeria, access is still a problem. Health financing is both from public, which is the federal, state, and local government sources, and private sources as well. As we can see from the chart, out-of-pocket expenses makes up almost 70% of health finances. Now, this out-of-pocket expenses has been consistently high and is, as can be seen, to be one of the highest in sub-Saharan Africa. The Nigerian National Health Insurance Scheme was established in 2005, and it was a federal government's initiative to improve healthcare financing and therefore coverage and access. Unfortunately, it is yet to yield fruit because 14 years down the line, still less than 10% of the population is covered, and this is still also mainly in the formal health sector. Nigeria has one of the least private health insurance coverage at about 2% or less, and the Basic Health Provision Fund, which has been established just recently, is expected to improve on the performance of the NHS. Now, public expenditure has remained low over time. Out-of-pocket expenses, unfortunately, has been constantly high as well. Now, despite the various policies and plans over the years regarding financing of healthcare in both public and private spaces in Nigeria, there's still much to be desired. As we can see, for example, that the over out-of-pocket expenditure as a percentage of private expenditure on health has consistently remained higher than 90% ever since 2002, and as of 2012, it was almost 96%. Now, as has been shown before, public health expenditure as a percentage of GDP in Nigeria has been consistently low, whilst total health expenditure as a percentage of GDP has been very high. Nigeria has one of the worst healthcare financing indices in sub-Saharan Africa. If we have a look at the table, we can see that Nigeria, despite its oil revenue, is still pretty much having one of the highest out-of-pocket expenses, and over time, almost in the last 2 to 3 decades or so, the health expenditure as a percentage of GDP has been constantly high, pretty much one of the has been constantly low, probably one of the lowest in sub-Saharan Africa as well, based on this data that has been provided. The organization of the healthcare system in Nigeria follow the 3 tiers of government. So we have the federal government, the state government, and the local government. The federal government takes care of the tertiary health institutions that are the university teaching hospitals and the federal medical centers. The state government takes care of the general hospitals, while the local government takes care mainly of primary health care. Now, funding is based on the national revenue sharing formula, which is inequitable due to political factors. Revenue, as we know in Nigeria, is mainly from oil, which is erratic. Local government, which is responsible for primary health care, has always been least funded. Private health care, which is relatively well funded, unfortunately, affordability is a problem, because even though good services are being provided, unfortunately, majority of the population in the country cannot afford. The unstable global prices of crude oil, they affect Nigerian revenue generation. Other factors such as inefficient taxation and corruption doesn't help either. So the result of this is that most health improvement and access program, which has been formulated by the Nigerian government over the years, failed to be implemented. A study by ILOCA demonstrated that the Nigerian health financing system is actually regressive based on the negative progressivity index. And as we can see, the health system continued to suffer with underfunding, inequitable distribution, poor insurance coverage, and increasing out-of-pocket health-related expenses. Now, the lack of funding of resources, significant out-of-pocket expenses, lopsided revenue distribution, all contributing inadequate health financing in Nigeria. The result of this is that the number of people without access to good care and being pushed to poverty continue to rise over time. We know that even in the current NIH, National Health Insurance Scheme, services only the elite of the population and those working in the formal sector, especially in the federal government, and that the poor and mainly who also contribute significant proportion of the people of the country continue to suffer. And we know that more than 70% of the Nigerian population live within the poverty line. So we can see the significance of the out-of-pocket expenses is really a very big problem for the majority of the population, because it is actually a catalyst to poverty. Then the proposals that have been put forward over time, there are quite a lot with regard to the ways in which healthcare financing can be improved in the country. The summary of this has been highlighted here on the screen, but I'll probably say that clearly some of them are more of a priority and urgent than others. For example, we know that in the Abuja Convention declaration in I think 2011, it was proposed that 15% of public spending should go to health. Unfortunately, we know that this has not been the case, which currently I think in Nigeria stands at about 6 to 7% at the moment. Furthermore, I just mentioned the issue of the insurance coverage for the poor and the lack of access to health financing for the poor. I think there is urgent need to provide insurance policies that can cover the vulnerable people in the society, especially the poor, and that the current NHIS, which is mainly restricted to the Nigerian elite, should be extended to the poor as well. So the Nigerian health system is struggling with its finances, and I think adequate financing is absolutely critical and necessary in order to enhance good access and quality to equitable healthcare, and that out-of-pocket expenses has continued to be a major problem